Oh, hi. I'm Joe Alton, MD of Survival Top 50's Reader's Choice website, doomandbloom.net, with over 1,000 articles, podcasts, and videos on medical preparedness. Together with my wife, Amy Alton, an advanced registered nurse practitioner, we're the authors of the Book Excellence Award winner in medicine, The Survival Medicine Handbook, now in its 700-page third edition, as well as the designers of an entire line of medical kits at store.doomandbloom.net. It's around Halloween, so I figured I'd tell you a horror story, a tale you might confront personally if you found yourself as the caregiver in a post-disaster scenario. In centuries past, women married in their mid-teens and often had 8 to 10 children. And no, that's not the horror story. The horror story was whether a woman survived her childbirth. Childbirth was so dangerous back then that when she found out that she was pregnant, a woman would sometimes make out her last will and testament. Let's look at the Mayflower. 3 women were pregnant when they boarded the Mayflower on its journey to America. One child, named Oceanus Hopkins, was born during the voyage but died during the first winter in Massachusetts. Another infant, Peregrine White, was born just off Cape Cod and did live to a ripe old age. A third was stillborn after the arrival at Plymouth. The mother died, sure enough, as a result of the childbirth. In addition to the fear of maternal death or of the child dying, there was no pain relief during labor, except maybe for whiskey. Of course, in Puritan communities, there wasn't much whiskey, and pain during childbirth was actually considered to be deserved. According to Genesis 3:16, it was thought that it was God's punishment for Eve and all women who came afterwards. In the year 1800, a woman's chance of dying during childbirth was about 2% per birth. If a woman gave birth to 8 or more children, well, her chances of eventually dying in childbirth were pretty darn high. And your chances were even worse if you were the baby. The chances of a child dying before their 5th birthday were around 20%. Rich women commonly employed wet nurses to breastfeed their babies for them, and you think this might have increased their chance of survival. But hormones produced during breastfeeding are nature's way of spacing out children. And as a result, rich women often ended up with more pregnancies than poor women. Well, at 2% mortality per birth, the rich might have had even worse outcomes than the poor. If you were a slave in the southern states, things were much, much worse for both the mother and baby. For good or bad, medical doctors began to take part in childbirth. They had the latest medical knowledge at their fingertips, but the latest 18th or 19th century medical knowledge wasn't, well, maybe always a good thing. Midwives were and are often still preferred today. At least having personal experience on their side, that helps. Physicians came, however, with the access to hospitals. The advent of hospitals, however, wasn't so great. As a matter of fact, the first hospitals in the U.S. were meant for poor folk that couldn't get doctors to come to their home. Before we understood bacteria and how infections spread, many of these places were death traps. In fact, the doctors themselves were often sources of infection for women in labor, going from patient to patient with unwashed hands and instruments. As a result, hospitals were places of last resort as post-childbirth infections ran rampant. In the 1840s, physicians began to wash their hands or use chlorine solution between obstetric patients. The more strict the hand washing routine, the lower the rate of infection in that hospital ward. But despite this, the idea didn't receive a lot of acceptance by the medical industry at large. By the year 1900, records show that 1,500 newborns died in one district of New York City, just one district every week. Childbirth changed dramatically, also in the 1840s, with the development of anesthetics like ether and chloroform. Queen Victoria of England actually used chloroform during her delivery in 1853. It was her 8th child. The main dangers for women in childbirth in the 19th century were the same, well, pretty much that you would see today in a long-term survival event. Prolonged labors, excessive bleeding, and infection. Large fetuses and in abnormal positions, women with narrow pelvises, they were difficult to deliver back then. They'll be difficult to deliver now. This required a doctor in the past to use instruments like forceps to pull the baby out, or in dire situations, use special instruments to crush the child's skull and remove it. You heard me. There were entire chapters in every obstetric textbook on destructive procedures to kill and remove a baby that was stuck in the womb. Often the baby was already dead at this stage, and there was a strong chance that the mother would also die. So these were decisions made in desperate situations. Desperate situations that you, medic, might face one day if something really happens that takes away modern medicine. Excessive bleeding was another common problem. It is still a risk in childbirth today. Modern obstetrics has recourse to drugs, however, which help to control it. In olden times, there were few things a midwife or doctor could do to stop a post-birth hemorrhage, and many women literally bled to death. Infection was another great scourge of childbirth. Women are very susceptible to infection during and immediately after the process of childbirth, and fevers usually would start maybe 1 or 2 days after delivery and spread to the blood within a week. The final outcome was often tragic. The greatest improvement in the reduction of bad outcomes was the decrease in the number of births per woman. Indeed, as smaller families became the desired norm, the emancipation of women helped save many lives. There were still many families that were large by modern standards, but by 1900 the average woman could expect to bear about 4 children. That's about half the number her mother had. Today, of course, it's even less. The other important development occurred in the late 1930s when antibiotics were introduced for medical use. By the end of World War II, the widespread use of antibiotics cut childbirth deaths to its present low level. Because of the importance of antibiotics in saving lives from infections, we wrote a book known as Alton's Antibiotics and Infectious Disease, which hopes to help the medic prevent avoidable deaths in disasters or remote settings. Our book is in formatting stages right now, should be out late next month, so keep an eye out for the release of Alton's Antibiotics and Infectious Disease, the layman's guide to available antibiotics in austere settings. You'll find it on Amazon, or you can pre-order it at store.doomandbloom.net. Childbirth is still a challenge. Have a baby, and as far as I'm concerned, you'll never have to prove your courage in any other way. This is Joe Alton, MD, that old Dr. Bones, wishing you the best of health in good times or bad. Thanks for watching.